Good afternoon. I'm Dr. Clifford Levy from Concord Orthopaedics, and welcome to this opportunity for me to interact with you in the public. A couple things I'd like to just go over about Concord Orthopaedics as we get started here. We're open for urgent and emergent cases Monday through Friday from 8 till 5. And we are also doing telemedicine appointments. Telemedicine can range through a variety of different options that are available. We can do direct phone calls where we can speak to you directly on the phone. We can work with you with different other platforms. We can FaceTime, Google Duo, video conferencing, where we're able to interact in a different manner. So we're around and we're available to interact like that. Our AIC or walk-in clinic is also open on a daily basis from 9 to 4 Monday through Friday, and we can see people there for urgent problems that you have, any questions that you have with that. You could always call ahead if you're concerned. Come on in. We're taking a lot of precautions right now to keep everybody safe from COVID-19 virus. We're working with taking everybody's temperature when you come in, a variety of questions. Everybody inside the building is wearing masks. Social distancing is being respected. And actually, when I'm in the office, I feel a lot safer in terms of possibility of getting infection than I'm in the outside world. It's very careful environment, and I think it's a very safe place to be if you have concerns to come in. Any questions people have, I'm happy to answer. In general, this time of year, one of the more common things that we start to see in the office are low back strains from people starting to get out and do a little bit of yard work. I would think in today's world, with everybody home a little bit more than usual, you might find that you have a little more time on your hands to do some things. One of the suggestions I usually have in that scenario is for people to spend a little bit of time warming up and loosening up before they go out and go about doing whatever activities they're interested in doing. If you feel like you've overdone it, take a day to relax, take it easy, and see how you feel as the day goes on. I have a very interesting question here, which is one that's really been on my mind. It's, do I see telemedicine being continuing into the future? And the answer to that is I really do. I think that telemedicine has been a source of a lot of enjoyment for myself, and I think for a lot of the other doctors. It gives us an opportunity to interact with patients in a way that's different than the normal office setting. We're able to speak for a little bit longer. There's not the same pressure of being around a whole lot of people. So it gives you an opportunity to interact in a different way. I was talking with one of my colleagues this morning as we were walking in, and we were both struck that it brings you back to a little bit of a different time when doctors made house calls. We're fortunate that people are inviting us into their home, if they're at home, which most people are during this time, for an opportunity to interact with them. I know I'm at home probably 99% of the time when I'm doing it. So it gives an opportunity to interact in a way that I think is a little bit more personal and a little bit more direct. And also in today's world, because right now a lot of the surgeries that we do are on hold due to trying to conserve the personal protective equipment, which has been, I think, without a doubt, the right thing to do, although it's really unfortunate for people who are having to wait. That equipment is really needed, and in places where it's short, it seems to be a real problem. But because we're not spending half our time or 60% of our time doing surgery, we're able to spend a great deal of our time in the office or on telemedicine connecting with patients. So I think that that's going to be something that's going to be here to stay. I think we can follow people a little bit more closely in terms of how often we interact through the telemedicine app. And I think for patients, it's terrific. You don't have to leave work. You don't have to leave home. We can speak directly. You save travel time there and back to the office. I think many of us find we're able to run our telemedicine visits on time. So it's a little bit more predictable. When that first started, I wasn't quite sure how that was going to work out, but it's worked out really well. So I think that that's something here. I think it's something that's going to be there for the future. How it tends to work itself through in terms of the platform that's used, I'm not sure I know the answer to that. I'm sure not anybody knows the answer to that, but time will tell. I have another question here about surgery for painful hallux limitus, which I'm not quite sure exactly where that question is. Hallux limitus rigidus. So if that's surgery relating to hallux rigidus with the big toe, the answer is yes. People can have that fixed, and I have two great foot associates. Another really good question here is about poor posture and what's the best thing to do for posture, which is a great question. I think oftentimes people see their posture and they go, oh, I don't like the way I'm standing. They look in the mirror. But a lot of times people's posture is just how your body is meant to be. But if you feel like you're slumped forward, there's a lot of risk factors for that. Working at desks, sitting a lot. And the areas that I think you can really improve your posture in is strengthening your upper back. If you work on strengthening your upper back, your shoulders will come back a little bit more and you may not feel your slump forward quite as much. So that's an area that with a little bit of exercise and a little bit of work in, I think can make a big difference. It's the type of exercise where I think if you do it every day, certainly a couple of times a day would be great, twice a day, where you can pull your shoulders back, squeeze your shoulder blades together, hold it for a count of 3 to 5, relax, do that 10 times, then do it again, squeeze it and hold it, and then relax. That's another way that you can do that. You might feel a little bit sore when you do that, but it'll certainly be helpful. Another one is when you're walking, if you think about walking with your chest sort of up and looking straight ahead as opposed to being down a little bit, that's another way you can work on improving your posture. Another great question here on exercises for a healthy back while people are working from home, which is another really great question. One of the things you can do is try to limit how much sitting you do without taking a break. If you can get up, take a break, walk around, that helps. Work on some exercises for your upper back. That will help. A lot of times your shoulders will tend to what we call internally rotate and be like that. If we can work on getting them out a little bit, that can help. A quick visit or two with a physical therapist for some band exercises can also be really helpful in terms of keeping your back strong like that. Likewise, hamstring flexibility is a good way to try to keep your back feeling a little bit healthy and improve your posture. And a little bit of stretching and flexibility for those go a long way. Oftentimes people ask me, what's one of the best exercises that you can do for your back? Which is really a great question. And it's a really simple answer to a question that's hard, and it's a hard one to do, which is walking. Walking is probably the one simple, best exercise that you can do to keep your back healthy, keep your back functioning well. If you can walk somewhere where it's flat, that's great. Most people live in New Hampshire. Walking someplace flat isn't quite as easy. Little hills are okay. But again, when you walk, if you're going out for a walk, for at least part of the walk with a little bit of intention where what you're going to do is you're going to look straight ahead, not look down in front of you. You're going to stand tall and walk with your shoulders back and your chest up. And I think that's a great way to work on improving your posture, keep your back healthy, get a little bit of just exercise in general, which can go a really long way to keeping your back feeling good and for years and years to come. It doesn't have to be fast. It doesn't have to be long. It doesn't have to be a big to-do. But if you can spend 10 to 20 minutes walking twice a day, great way to go about keeping your back healthy in terms of that. Other recommendations that I would have for a healthy back would be to try to wear comfortable shoes that are worn, particularly on one side more than another, will leave you a little bit lurching to one side, could put some stress on your back, put some stress on your pelvis and your hips, and can lead to the onset of back pain. Likewise, heels that are very high aren't great for your back, nor are shoes that are very flat. I don't know how many people remember what were called earth shoes, which were shoes that were sort of high in the front and low in the back, and that caused a lot of back problems. But walking is the one best thing to do. A little bit of flexibility and stretching for your hamstrings, a little bit of work to keep your upper back strong and your shoulders back, and that goes a long way, I think, to keeping your back as a whole healthy. Those are all some really great questions. It's one of those things I think that's simple to do but hard to necessarily keep up with. Another interesting question here is sleeping with a weighted blanket. Is that bad for you? That's a great question. So sleeping with a weighted blanket, I don't know if it's necessarily bad for you or good for you. I think one of the things that's really great and really hard in today's world also is trying to keep your back healthy with some sleep. And I've often said if I see a patient who isn't sleeping well, almost for sure whatever their problem is going to feel worse. So trying to get a good night's sleep is a great way to try and keep every problem as well as you can under a bay. Easy thing to say, hard to do. The suggestions I usually have for sleep are some of the same that are out there for everybody is try to take your sleep seriously. If you have a hard time falling asleep, reduce stimulation before you go to bed. A little bit of fresh air if it's not too cold out also is really helpful. I think in terms of getting a good night's sleep, I don't think there's any one position to sleep in, side, back, or stomach, that makes a particular difference. Likewise, in terms of pillows, again, not a big to do. Whatever is really comfortable for you in terms of keeping yourself healthy with sleep is good. And a good recommendation for sleep, depending upon the person, is 6 to 8 hours. Great question here on how to connect with telemedicine and telemedicine appointment. If you call the office, it doesn't matter what state you're in. You can be in North Carolina, Florida, Illinois, California. If you call the office and say, I'd like to make a telemedicine appointment with myself, with any other providers in the office, we can absolutely 100% connect through telemedicine. Again, sort of the simple ways it can be a direct phone call. Great way to start. If you have a smartphone or the ability to do FaceTime or Google Duo or any of the other video apps, those are all a really nice way to connect in terms of telemedicine. And we're around and we're available for telemedicine, and always nice to hear from people that way. Good question here. What stretches do you recommend for lower back pain? I sit all day for work and I'm worried for my lower back. Great question. So if you're sitting all day for work and you're worried about your lower back, I think your concerns there are a little bit accurate in terms of what to do. It's kind of the simple thing that can make a little bit of a difference there would be, one, get up from sitting. Sure, easy to say. Secondly, the other thing that can be kind of helpful is to work on keeping your hamstrings as flexible as you can and as strong as you can, and likewise your hip flexors. So stretches that I like for those are stretches of your hip flexors, stretches of your hamstrings. Stretching your lower back can be a little bit more challenging to try to do, and isn't always necessarily the easiest way to do it, and sometimes you can overdo it with that. But I think stretching for your hip flexors, stretching and strengthening for your hamstrings, your upper back and posture are probably the best ones that you can do to try to keep your back healthy. Another big part of stretching is when you stretch. Do you stretch just after you've been sitting for a while? Do you stretch after you do a little bit of exercise? Those are good questions, and I don't know if there's always a right answer for everybody in terms of that. I think if you can do a little bit of activity and then stretch, it's way better than just stretching. So if you've been sitting for 90 minutes and you're like, I need to take a little break, if you can get up, walk around 30 seconds, 90 seconds, whatever it might be, get yourself moving a little bit, then start with your hip flexors, stretch those out, do a little bit of stretching for your hamstrings. If you can get your quadriceps in there stretching a little bit, that's great too. A little bit of work for the upper back to get your shoulders back, and then just keep at it is the best thing that you can do with that. Question here about neck pain and bulging discs. Can they cause vagal responses or episodes? And the answer to that is yes, they can. I think any pain can cause what we would call a vagal response. So the answer to that would be yes. I don't want to go into too much detail about vagal response here, but the answer would be yes. Great question here from, it looks like, New Jersey, about somebody who has a back that tends to bother them after being on their feet all day. Is a heating pad a good option? And the answer is a heating pad is a great option. And one of the things to do if you're up on your feet all day, comfortable shoes are terrific to keep yourself so that you're not standing off balance. Support socks to give a little compression to your calves to help with blood return. A little bit of walking, a little bit of light exercise. Those also are good. And heat will make most things feel better. And it'll also make things a little bit looser, and as a whole you'll feel better. Nothing wrong with heat. Heat is great. Ice is good too. Some people like one more than the other. Which one feels better it varies a little bit from person to person, but a heating pad is great. Good shoes are great, and anything to help with blood return in your legs also will help with that. Another really great question here about core strength, and somebody's back feels much better when their core is strong, and that's a great question. That's true. The stronger your core is, the less stress there is on your back. And a lot of times people say, well, my core this and my core that. And what do they mean by core? I can tell you my definition for core. So my definition for core is your abdominal muscles, which are helpful. The muscles of your rear end, your gluteal muscles. If your gluteal muscles are strong, it gives a lot of support to your lower back. Your gluteal muscles are way stronger than the muscles in your lower back. So when those are strong, they help take a lot of stress off your lower back. Likewise, your oblique muscles are real important in keeping your core strong as well. Everybody's a little bit different in trying to find the right exercise program for them to keep their abdominal muscles strong, to keep their obliques strong, to keep their gluteal muscles strong, as well as to keep your proximal hamstring strong. It takes a little bit of work to find the right one for each person. Some people like more active exercises. Some people like a more static exercise like a plank or a side plank. I don't know that there's any one best exercise. I think a variety of them work well, but the stronger your core is, the less stress there'll be on your lumbar spine. The less stress there is on your lumbar spine, the better your back feels. If I was really pushed and I had to pick one exercise or one muscle group to make things stronger, the one that I would say would be your glutes. I think when your gluteal muscles are strong, there's just a little bit less stress on your lower back. Your pelvis will be stronger, and your back will move a little bit more fluently and a little bit easier in terms of how you go about things. If you're a little bit more advanced in exercising, the so-called hip hinge is a great way to keep your glutes strong, and the stronger you can get your hips to hinge, the better it'll be. I suppose if we were going to get into how to exercise, I would say a hip hinge type of exercise for your glutes is a great one versus a static one. If I had to pick one for your abdominal muscles, I'd probably pick a plank, and one for your obliques, I'd probably pick a side plank. If you really like to exercise, there's something called an ab wheel, which has been around for a long time, which also can be really, really well at keeping your core strong. A real simple one to start with for your glutes, likewise, is any sort of bridge type of exercise. Although I'm not a fan at all of an exercise that's been around fairly recently that seems popular, which is a barbell thrust, where you're lying on your back, you put a bar with a lot of weight across the front of your pelvis, and then try to do a bridge to bring it up. I just don't like that exercise. I think people get hurt doing that, and I've seen people with that get hurt. So I would stay away from that. Another great question here on a posteriorly tilted pelvis. Does keeping your pelvis posteriorly tilted help with back health and posture? I think that's a good question, and I think there's some variation from person to person. I don't know that there's one best answer for that. I think that when your pelvis is in a neutral position that supports your spine in the best overall situation that's right for you is the best way to do it. I think trying to move your pelvis to keep your posture good can be hard, as opposed to making your core as a whole, like that great question from before, making your core as a whole strong. Stronger your core is, the more natural a position your pelvis will fall into. Nice question here. Any good tips for low impact exercises that are easy on the knees? Great question, kind of a harder answer. So low impact exercises, depends what you have access to. So walking is great. Softer ground is better than harder ground. Even ground is better than uneven ground. But finding soft, even ground is a little bit harder. Treadmill, if you have access to it, is terrific. An elliptical, if you have access to it, likewise, low impact. I think an exercise bike varies a little bit from person to person, and some people find that helpful and some people find that not to be as helpful. How you stress your knees also depends upon what you're necessarily doing with them. In terms of knee health, I think, again, keeping the muscles strong around your knee sure goes a long way to keeping everything healthy, that whether it's your quadriceps, your vastus medialis, your hamstrings, those are all ones that you can work on as far as the knees go. And then good footwear. If your footwear is uneven, it's going to put more stress on your legs as you're going. Interesting question here. I'll do my best to answer it. Any foods to avoid to help with neck pain flare-ups? Well, that's a question I don't know that I'm the most knowledgeable person to necessarily answer for. I think that there's some foods that are thought to be really inflammatory foods. There's other foods that are thought to be anti-inflammatory foods. I think if you eat something and it doesn't agree with you, it's probably a really good idea to stay away from it, whether it's considered an anti-inflammatory food or an inflammatory food. Likewise, if you follow a healthier diet, that's probably the best thing you can do overall. But there isn't a specific anti-inflammatory diet that I feel like I have some expertise in to be able to tell you, well, avoid this or make sure you have plenty of that. I think that there probably are some things that fall into that category and a little bit outside of my area of expertise. Good question here on SI joint injections. Somebody had some SI joint pain. Sounds like they had an SI joint injection, which gave them relief of some muscle spasm, but now they feel like their glutes are weak. What can you do to try to get your glutes, and they're not responding to exercise? I think that most muscles will respond to exercise. They may not just respond as quickly as you would like, and sometimes that can be months to years of exercising to get something, particularly if you've had a problem for a while. In general, the variables that with exercise that I think are important are one, and this is true for every exercise program, are the intensity of the exercise, how hard are you exercising? The duration of the exercise, how long you're exercising for. How many different muscle groups are involved with your exercise, whether you're doing something that just involves one muscle group or whether you're doing something that involves multiple muscle groups are important. And the other one is recovery. Before you exercise, you need to recover. If you're exercising a muscle that hasn't recovered, it becomes hard to build that muscle back up because it hasn't recovered. So if you're having a hard time with strength or building strength, it's one of those variables aren't right for you. And oftentimes, multiple bouts of short, not overly demanding exercise is a great way to get things going again. Here comes a great question about tech neck, from necks slumping down because they're on a cell phone or a device or a computer, and what are my thoughts on tech neck? I think that's a great question, and I think that over the next few years we're going to see a lot more developed in terms of the ergonomics or how you're supposed to have your body together. So I think if you're staring down at a phone or staring down at a device, your neck is going to be fixed in any one position for a long time, and it's going to hurt. Just like if you're sitting in a chair that's uncomfortable, it's going to hurt. Your neck, generalization, is designed for mobility as opposed to it being a really strength-driven region of your body. So we were talking earlier about your back with gluteal muscles. That's something that's really designed for strength more than mobility. The range of motion in your glutes is more limited than the range of motion in your neck. Your neck's going to move forward, back, side to side. It's going to rotate. So there's a lot of different areas that move, and your neck is more built for mobility than it is for strength. So if you hold your neck in one position for a long time, you're really working against how it's designed to work. So I guess the best advice I would have to try to avoid so-called tech neck would be ergonomically designed workspace. Now, for the folks that might be, let's just say, past 40, and you're wearing bifocals, that's one thing to take into consideration in terms of how your device is. You may have the device designed at a right height, but if you're always having to move your head to read through your bifocals, that's going to make it a little bit harder to do. So I think tech neck is a problem. I think looking down all day is a problem. Right now, I'm on my phone, but I have it in a device that's keeping it at a really comfortable height for me, so I'm looking straight on as opposed to having to look down on it. So it's something that I think we all need to work on to try to avoid. Good question here. Does spinning on a stationary bike lead to back issues? So that's a great question, because that's really popular now. It's a great exercise. It's a great way it's a great low impact exercise where you can get your heart rate up. Getting your heart rate up is a great way to stay in shape. So do I think that spinning on a stationary bike leads to back issues? The answer is, I would tell you that I think spinning on a stationary bike can lead to back issues. I think any exercise program, and if you're on a spin bike, you're probably interested in exercise and you're working at it on a pretty regular basis. Um, uh, and you want to have a program that is not just cardiovascular if that's why you're using your spin bike. It's not just leg muscles if that's why you're using your spin bike, but incorporates really trying to exercise through your whole system. So I think a spin bike is a great way to work your heart. I think it's a great way to get your legs stronger. I don't think it can necessarily lead to back problems if your exercise program encompasses everything that it needs to for your overall health. One suggestion that I would have with a spin bike is having your seat adjusted in a way that seems to be comfortable for you. And there's probably a fair amount of information that's out there, whether on YouTube or whatever, about how to adjust your seat. But finding the right seat adjustment for you may not be exactly the same. Some people might feel a little more comfortable being forward. If they have a little bit of underlying spinal stenosis, having your spine forward flex gives a little relief. Some people might find being fixed in that forward position really uncomfortable. A little bit more upright, so whether you move the seat closer to your handlebars, whether your seat's elevated a little bit more, I think you can work with that to find something that's comfortable. But keep in mind, if you're sitting on a spin bike and exercising, it's like sitting in a chair without any support for that period of time. So long before spin bikes, people would come in and say, oh, I'm sitting on bleachers. Sitting on bleachers are so uncomfortable. And with a spin bike, you're sitting unsupported. You know, your feet are locked into one position, your legs are moving, but the rest of you, in general, I think is probably fairly fixed. So I would look at it as incorporating it as part of an exercise program as opposed to being the only part of the exercise program. Another question that just came across, and I just want to reiterate to people that we're open for telemedicine. If you're a nurse or in healthcare and this is a hard time to get away, if you give us a holler, we can set up telemedicine appointments to work during your break, during lunch, a variety of times. So that's those options are out there. Another question here about arches, that they have low arches. Any recommendation for shoe inserts, what to stay away from? If you think you have a problem with your feet with arches and you think you need an orthotic, my recommendation would be to have it professionally evaluated. I have two associates who do foot and ankle work who I think are fantastic. I think that if you put something in your shoe that isn't really meant to be in your shoe, or change your foot for a way it isn't meant to be, it certainly is a good way to have things hurt. So before starting with shoe inserts, I would recommend having somebody take a look at it and make sure you get the right insert for what your issue is, for the activity that you want to do, and for the shoes you're going to want to wear. You can go into the drugstore and stand on the different devices to see what's what. And you can spend a lot of money on inserts that may not do much to make things particularly comfortable for you. So I'd like to take this opportunity to just thank everybody for the questions. This has been fantastic. If you have any questions, concerns, call the office. We can make appointments, telemedicine, in person. We're open. We're taking terrific precautions to keep everybody safe. I think this is a really important time for all of us to work on staying safe, staying healthy, social distance, wash your hands. Washing your hands is really a great way to keep yourself healthy, and great way to reduce germs. It's really simple to do, and I'd encourage all of us to really make that a real habit. Wash your hands if you touch something. Think about what you're touching and then where your hand's going next. How many hands are on a doorknob? A whole lot. And Uh, it's not where you want your hand to be without getting it clean afterwards. Personally, I try to avoid doorknobs as much as possible. If I'm walking at work and door's on its way closing, I always try to catch it with my forearm or elbow to push it open rather than my hand. It's probably the best way to do it. So there's one question here, and I'm going to answer it, but I'm not up on what it is. Have I tried a PSO right? And do I have an opinion? I don't know what a PSO right is to answer that question. So my apologies to that individual. So I want to thank everybody for their time. This has been terrific. It's been a great opportunity for me to see some questions from people who I've known. And I want you all to know I remember everybody whose name came across here along with lots of others. It's really been a privilege over the last 30 years to take care of people. So thank you all so very much. Stay safe, wash your hands, social distance, and we're going to close things off now. I'll be back again in the near future when I'm scheduled, and I look forward to seeing everybody as well as some new questions. So thank you all very much. Have a wonderful afternoon. Stay safe. We're open. We're available. And have a good afternoon. Bye-bye.